If your knees hurt every time you climb the stairs, if you find yourself dreading that trip to the second floor, or if you've started avoiding stairs altogether, what I am about to share with you could change everything by tomorrow morning. I am not exaggerating. A University of Vermont study found that seniors who performed the exact exercises I am about to teach you saw a 40% improvement in knee function within just 8 weeks. But here's what the study didn't tell you: some of my patients notice a difference in as little as 3 days. The best part is that you can do everything I'm going to show you tonight while sitting in your favorite chair, without any equipment, without pain, and without leaving your living room. Before I reveal the 3 exercises, ranked from good to best, I need to warn you about the 3 mistakes that stop them from working. Mistake number 2 is one I see constantly, and it is likely the reason other exercises haven't worked for you in the past. I'll reveal all 3 mistakes shortly, and trust me, you do not want to skip that part. I am Dr. Michael, and for the past 20 years, I have dedicated my career to helping seniors move without pain. I have worked with thousands of patients and seen exactly what works and what doesn't. I have watched people go from being afraid of their own staircase to climbing mountains with their grandchildren. The exercises I am sharing with you are the exact same ones I teach in my clinic every single day. They work. Stay with me until the end, and you will have a complete system to start feeling better as soon as tomorrow. Before we get to the movement, drop your age in the comments right now. I want to know who I am helping today. Now, let's explain why stairs hurt so much in the first place. Once you understand what is happening inside your knee, everything else will make sense. When you climb stairs, your quadriceps muscle, that big muscle on the front of your thigh, has to work overtime. Think of your quadriceps like a powerful crane. Every time you take a step up, that crane has to lift your entire body weight. For a 160-pound person, that is 160 pounds being lifted with every single step. Multiply that by 14 steps to get to your bedroom, and your quadriceps has to lift over 2,000 pounds just to get upstairs once. Here is where the problem starts. After the age of 50, most people lose between 3% and 5% of their muscle mass every decade. A study published in the Journal of Gerontology found that by age 70, the average person has lost nearly 30% of their quadriceps strength compared to when they were 30. That is like asking your crane to lift the same heavy weight with only 70% of its power. So, what happens when your quadriceps gets weak? Your knee joint has to pick up the slack. Think of your cartilage like a shock absorber in your car. When it is thick and healthy, you glide over bumps. But when it wears thin, every pothole goes straight through the frame. That is exactly what is happening in your knee. When your quadriceps cannot absorb the force, your cartilage takes the hit, and bone starts pressing against bone. That grinding, aching, sharp pain you feel is your shock absorber wearing out because your crane isn't doing its job. When was the last time you climbed stairs without even thinking about your knees? If you can't remember, that tells you exactly how long this problem has been building. But here's the good news that most people don't realize: your quadriceps muscle can get stronger at any age. A groundbreaking study from Tufts University proved that adults in their 90s were able to significantly increase their muscle strength with the right exercises. If 90-year-olds can do it, so can you. Take Robert, for example. He is a 68-year-old retired engineer who hadn't climbed the stairs in his own home for over a year. He was sleeping in a hospital bed in his living room, and his doctor suggested a stairlift. I taught him the exercises I'm about to teach you, and he agreed to try them for just 2 weeks. On day 4, he called to say his knees felt less stiff. By day 10, he walked up 3 stairs. By week 6, Robert canceled his stairlift order. Last month, he sent me a photo of himself at the top of a hiking trail with his grandson. That is the power of this routine. Let's dive into the 3 exercises, starting with number 3 and building up to the most important one. Exercise number 3 is called the step-up prep. This simulates the exact motion of climbing stairs but in a controlled, seated way. You will need a thick book or a low step, about 2 to 4 inches high. Place it on the floor in front of your chair. Sit with one foot on the book and one on the floor. Press through the foot on the book to stand up, straightening your leg, then slowly lower yourself back down. The key is to use the leg on the book to do the work. Do 10 repetitions. On the right, then 10 on the left. This teaches your legs to handle the specific movement pattern of stair climbing. Exercise number 2 is the seated march. This targets your hip flexors, which lift your leg to take a step. Sit in a sturdy chair with good posture. Lift your right knee toward your chest like you are marching, holding for 1 second at the top, then slowly lower it. Alternate legs for 30 seconds, rest, and repeat 3 times. Dr. Sarachin at Johns Hopkins found that seniors who trained both their quads and hip flexors improved their stair climbing ability twice as fast as those who only trained their quads. Now for exercise number 1, the most important movement of all, the seated leg extension. This is the single most effective way to strengthen your quadriceps without stressing the knee joint. Sit in a firm chair with your feet flat and back straight. Slowly straighten your right leg out until it is completely parallel to the floor. Hold that position for a full 3 seconds. You should feel a burn in your thigh. That burn is good, it means your crane is getting stronger. Then, slowly lower your foot back to the floor. Here is the secret sauce, the timing. It takes 2 seconds to lift, 3 seconds to hold, and 2 seconds to lower. We call it the 2-3-2 tempo. This slow control forces your muscle to work through the entire range of motion. Do 10 repetitions per leg, rest, and complete 3 sets. The whole routine takes about 10 to 12 minutes. However, none of this works if you make the 3 common mistakes. Mistake number 3 is holding your breath, which raises blood pressure. Breathe out as you lift, and breathe in as you lower. Mistake number 2, the big one, is not fully straightening your leg. The final few degrees of straightening, called terminal extension, are responsible for 70% of your quadriceps strength and functional movements. If you don't lock your knee out straight, you are missing most of the benefit. Mistake number 1 is going too fast. Momentum is not your friend here, muscle control is. Slow down to get 40% more muscle activation. Here is a fascinating fact: the benefits of these exercises continue while you sleep. When you exercise in the evening, your body releases growth hormone during deep sleep to repair muscles. You literally wake up stronger. That is why I recommend doing this routine about an hour before bed. This brings me to Helen, a 73-year-old grandmother who had been sleeping on her couch for 8 months because she couldn't manage the stairs. After just 14 days of doing the seated leg extension properly, she climbed all 12 stairs to her bedroom. 3 months later, she sent me a video walking up those stairs carrying her 3-year-old granddaughter. She wrote, "You gave me my life back." To get these results, start with the seated leg extension for the first 2 weeks, 3 sets of 10. In weeks 3 and 4, add the seated march. By week 5, add the step-up prep and consider adding light ankle weights. This progressive resistance is key. Just like Patricia, a 69-year-old who is afraid of falling, you will build not just strength, but confidence. After 3 months, Patricia was climbing stairs without even holding the railing. So, here is your action plan. Tonight, simply do 3 sets of the seated leg extension. Focus on the 2-3-2 timing. If you feel sharp joint pain, stop immediately, but don't fear the muscle burn. That burn is your strength returning. Tomorrow morning, pay attention to your knees. If the stairs feel even 1% easier, that is progress. Please hit that subscribe button if this helped you, and share this with someone you love who is struggling. You might just give them their independence back. Now, will you try exercise number 1 tonight? Drop a yes in the comments, tell me your age, and let me know your story. Your knees haven't given up on you, so don't give up on them. It is easy to underestimate the profound impact that reclaiming your mobility can have on your overall health. When your knees are strong, you move more. When you move more, your circulation improves, your heart health gets a boost, and your mental clarity sharpens. It is a positive ripple effect that starts with that simple quadriceps muscle. Conversely, avoiding stairs and sitting more leads to a cycle of decline that affects your hips, your lower back, and your balance. By strengthening the crane, you are essentially protecting your entire skeletal system. You are not just fixing a knee, you are securing your ability to walk, travel, and play for years to come. Do not let skepticism keep you seated. The science is sound, the method is safe, and the results are waiting for you. Make the promise to yourself right now. Tonight is the night you take control.